In this video, we are going to talk about quick notes on anti-epileptic drugs. This is part 3 of these drugs. You can find part 1 and part 2 in the description box. So let's get started. So first drug is phenytoin. Phenytoin blocks voltage-gated sodium channels by selectively binding to the channel in the inactive state and slowing its rate of recovery. This drug is used in the treatment of focal and generalized tonic-clonic seizures and status epilepticus. Phenytoin exhibits saturable enzyme metabolism, resulting in non-linear pharmacokinetic properties. So, a small increase in the daily dose can produce large increase in the plasma concentration, resulting in drug-induced toxicity. This drug has gingival hyperplasia as a side effects, and it may cause the gums to grow over the teeth. So the next drug is fosphenytoin. Fosphenytoin is a prodrug that is rapidly converted to phenytoin in the blood within minutes. This drug can be administered via IM route, while phenytoin itself cannot be given by IM route because it can cause tissue damage and necrosis. So fosphenytoin is the drug of choice and standard of care for IV and IM administration of phenytoin because fosphenytoin will be converted to phenytoin in the blood within minutes. Rufinamide. Rufinamide acts at sodium channels, and this drug is approved for the adjunctive treatment of seizures associated with Lennox-Gastaut syndrome in children over age 4 years and in adults. This drug has a side effect which includes the potential for shortened QT intervals, and the patients with familial short QT syndrome should not be treated with rufinamide. Eslicarbazepine acetate is a prodrug that is converted to active metabolite eslicarbazepine by hydrolysis. Eslicarbazepine is the active metabolite of oxcarbazepine. This drug is a blocker of voltage-gated sodium channel and is approved for the treatment of partial onset seizures in adults. The side effects include dizziness, somnolence, and diplopia. Ethosuximide. Ethosuximide inhibits T-type calcium channels, reducing the propagation of abnormal electrical activity in the brain. This drug is effective in the treatment of absence seizures. Ezogabine. Ezogabine opens voltage-gated M-type potassium channels, leading to the stabilization of the resting membrane potential. The side effects include urinary retention, QT interval prolongation, and retinal abnormalities. So that's it. Thanks for watching. If you like the video, don't forget to like, share, and subscribe, FarmSep. Thank you.